Signs and symptoms of bipolar disorder and what to do. Imagine being on an emotional roller coaster and feeling either on top of the world or entirely drained of energy. While everyone faces mood changes occasionally, frequent sudden and extreme mood swings that negatively affect your life indicate an underlying mental health problem. Bipolar disorder is a mental health problem involving drastic changes in mood. It is an episodic disturbance of behavior with periods of elevated and depressed mood, also known as bipolar disease or manic depression. People with bipolar disorder face difficulty in performing tasks in everyday life. Maintaining relationships is also a hurdle. The risk for developing bipolar disorder during your lifetime is 1 to 2%, yet it affects millions worldwide. There's no specific cure for this mental illness. However, many treatment options are available to manage its signs and symptoms. Being unusually energized can be a sign of the bipolar disorder. People with bipolar disorder have episodes of severe emotional highs and lows. Individuals with bipolar disorder feel overly excited and energized to the point that they feel invincible in an emotional high phase. They appear unusually friendly, outgoing, super productive, and report feeling exceptionally good. Staying happy and too optimistic can be mistaken for getting better. However, these symptoms are alarming and worrisome as they can progress to mania without treatment. Hypersexuality is a troubling symptom if you have bipolar disorder. It means an excessively high sex drive and sexual impulses, and usually peaks in manic episodes, making you exhibit sexual behavior that's not typical for you on your regular days. Bipolar disorder may lead to restlessness. During manic episodes or emotional highs, you're full of energy. Since bipolar disorder affects your brain, your central nervous system is also affected. Constant irritability and hyperactivity can induce restlessness. This inability to relax and feeling unusually hyperactive may cause difficulty in concentrating and controlling your thoughts as well. Altered sleep patterns are a common sign of the bipolar disorder. These sleep disturbances often follow a manic phase. Excessive energy levels and hyperirritability keep you from falling asleep or staying asleep for the required time. Prolonged periods of fatigue and inability to sleep can then result in excessive sleeping for long hours. It's a vicious cycle that continues to go on in bipolar disorder. Bipolar people are often indulged in compulsive behaviors. These compulsions are behavior patterns or activities that they're driven to do again and again. Around 15 to 20% of people with bipolar disease also meet the criteria for obsessive-compulsive disorder. These behaviors may include binge eating, going on a shopping spree, or a sudden and excessive focus on religion. People with bipolar disorder tend to show signs of impulsivity and act out in minor or unimportant situations. Their behavior may be of extreme happiness, eagerness, or anger. A person with the bipolar disease may yell, get violent, or use harsh words upon the slightest triggers. Impulsive aggression poses a severe risk to the safety of oneself and others. Impulsivity is often observed during manic episodes. The mood swings are not only limited to emotional highs and feeling invincible. Bouts of sadness and hopelessness also affect bipolar individuals. Emotional lows can be debilitating and depressing. These episodes are of great significance because without treatment, they become severe and can result in self-harming or suicidal thoughts and behaviors. Periods of having anxiety, low self-esteem, and excessive guilt can sometimes occur in combination with high-energy manic symptoms. This is extremely dangerous as the person feels exceptionally motivated and depressed at the same time, so they are more likely to exhibit and indulge in destructive behaviors. The symptoms like impulsiveness, self-harm, and depression in people with bipolar disorder can often lead to increased alcohol consumption or drug abuse. Drinking alcohol can worsen mania due to its sedating effects. Episodes of emotional lows and breakdowns may also trigger the patient to overdose on drugs or consume excess alcohol. Do you or a loved one have symptoms that indicate bipolar disorder? If so, it is best to seek help from professional therapists or psychologists. Life events, having a family history of bipolar disease, sleep deprivation, and certain medications often act as triggers. A detailed analysis of your history and symptoms allow your doctor to make an appropriate diagnosis for your condition. An accurate diagnosis helps you manage your symptoms and meet your goals. Besides medication for mood stabilization, psychotherapy can be useful in managing the psychological symptoms of bipolar disease. Therapists use various techniques that help you manage your emotions during emotional highs and lows. Cognitive behavioral therapy, interpersonal and social rhythm therapy, and family-focused therapy are common approaches used by psychologists for bipolar patients. Additionally, group therapy can be beneficial for getting support from people going through the same journey. The relapse rate of bipolar disorder is usually high, even with ongoing therapy, or if the patient seems to be fine in between the episodes. After having the first episode, the annual risk of having another episode is 10 to 15%. The relapse percentage rises as the episodes increase and become more and more common. However, some self-help strategies can be helpful with reducing relapses if utilized with proper treatment. Maintaining an active and healthy lifestyle is one of them. Regular exercise and quitting unhealthy habits like smoking and drinking can positively impact your mental health. Caffeinated drinks like coffee and sodas should be avoided as caffeine can trigger energy levels and worsen the symptoms of bipolar disorder. Additionally, meditation and relaxation techniques can work wonders if you feel hyper-excited or too gloomy during your episodes. They allow you to keep your impulses in check and manage extreme emotions like anger or compulsive behavior. It is essential to reach out to your friends and family and discuss your feelings and emotions. If a loved one has bipolar disorder, remember that the disease is not the person. The best way to help a friend or a loved one with this mental disorder is to stay up to date and educated about its manifestations.